Welcome back to another episode of One Clear Vision with Dr. Sophia Capo of ABC Optometry and Vision Therapy. This is our third take. I'm still excited to have you back in studio with us. We've spent time breaking down a lot of things that you have so graciously taught us on eye health, and this video is going to be sort of a chapter review. We're going to go back and revisit some of the information you shared with us. Hello. Hi. Okay. So at what age should we bring our children in for their first eyesight exam?
So first eye exam should be at age 6 months. So at age 6 months is when a child's eyes should be aligned. We should be able to check the prescription at that time to make sure that developmentally the eyes are doing okay. And we can rule out a lot of really bad things or intervene if we need to at this age. So 6 months for the first one in an ideal world. But if your child is over 6 months and hasn't had one, that's okay. Anytime is a good time.
Come see you right away. What are some of the common signs of vision trouble or potential problems that we should be watching for and bringing them in?
So in children, what we're looking for, of course, are the obvious things like they're squinting or they say they can't see or things are, they report, blurry vision or fuzzy vision. But some of the other things that children might not tell us, sometimes the eye wanders. So a parent will see the child's eye turn inward or turn outward. Or the child might be struggling with reading at school or the child might have headaches. So those are some other things that we can ask a child or that we can rule out even if the child can't communicate with us.
And so we bring them in at 6 months, but what is the frequency of the eye exams? How often?
So 6 months ideally is the first one, and then we want to see them annually thereafter. So 6 months and then like a year and 6 months, and then we continue on our schedule from there. And the reason why we want to keep seeing them every year is because things change in children and they can change frequently as the child grows. And they also, like, kids don't know that they can't see. So just because a child sees, has 20/20 vision doesn't mean that from 1 year to the next, they might have more visual fatigue or their visual demands increased at school. So like as we get into higher grades, the font size gets smaller, the books get longer, our visual demands change. True. And so what, a child was once compensating for, it might not be the case on a subsequent exam. So we want to see them every year, even if they feel like things are okay, because we find things all the time that we don't even realize are stemming from the eyes. But we find them, we fix them, and then we solve a lot of problems.
And that leads so nicely into my next question. Can undetected vision problems affect learning, school performance, behavior?
Absolutely. So we know, and we talked about this in a previous episode as well, that not only do we need our eyes for clarity, but we also need our eyes for coordination. And our eyes need to align properly. Our eyes need to focus properly in order to do a really complicated task like read. So if a child has an undiagnosed eye problem, whatever that may be, that could definitely affect, and we know this from the research, the speed of their reading, the degree of their comprehension, and also just their fatigue, their stamina, their ability, and then their attention. Because if someone can't read, or if a child has double vision and they don't realize, that can be, misdiagnosed as something like ADHD. And remember, in ADHD and in children with autism and other developmental delay, eye clarity problems and eye coordination problems are more likely to happen. And so, definitely if any child is struggling with any of those things, or even if they're going for testing for those types of conditions, it's always great to do the eyes first and make sure they have a full comprehensive assessment so that we are 100% sure that our diagnosis afterwards is based off of the correct.
So let's talk about that. What is the difference between vision screening and a comprehensive eye exam?
So vision screenings are sometimes done by like a school nurse or by volunteers that go into the school, or sometimes like even like community groups like a Rotary Club and Lions Club will go into schools and do screenings.
Okay.
Essentially what they're looking for in a school screening is whether or not a child can see clearly. But remember, clarity is only one small piece of the puzzle. So the comprehensive eye exam that you can get at an optometry office is the one that tells you, you know, does my child have a hidden prescription because we're using the eye drops? Does my child have an eye coordination problem? Do they have an eye focusing problem? And all of those things are still eye problems that need to be addressed, but you won't pick those up in a school screening.
The amount of time that kids are spending on devices, screen time, I think we might pop the television on or hand them the iPad when we just need a minute to make dinner, but I think it has significant negative impacts.
Let's talk about it. So screens themselves don't necessarily cause problems with eye health. So for example, by spending more time on the screen, we don't have data that says, you know, my child's going to get macular degeneration faster or something like that. Okay. What we do know is that a screen is a close task. And every time we're doing something up close, we're using our focusing system, and our focusing system has to stay on. Now, what that can do is that can make everyone a little bit more tired. So children can just fatigue faster when they're on screens. Screens can also cause dry eye because we tend not to blink as much when we're on screens. And we know that from a psychological standpoint, that screens are not good for development, because while we're doing screens, sometimes that means we're missing out on things like puzzles, which, you know, promote gross motor and fine motor skills, or, you know, being outside, which, you know, teaches you other things and gives you other health benefits. And remember when we were talking about myopia control, so children who are nearsighted, whose prescriptions keep changing every year after year, we know that being outside is protective. We know that people who spend more time outside are less likely to have really high prescriptions. So even though screens aren't, you know, causing a direct impact, doesn't mean they're not indirectly causing some issues.
So for the times that we have our children using screens, so this is a myth buster for me. Do they need to wear the blue light?
Blue light glasses?
Is that a thing?
Blue light blocking glasses do help with sleep. So we know for sure that blue light, because there's blue light in the sun, and there's more blue light coming out of the sun than there is coming out of our computer screens. So blue light isn't damaging in that sense. We don't have any research that says that, you know, looking at a screen again is going to cause more macular degeneration. And we don't have that right now. Maybe we will in the future, but right now we don't have it. But blue light blocking glasses we know are helpful at the end of the day, because blue light does affect our sleep and our circadian rhythms. That being said, everyone who's on a new device, so like an iPad, a laptop, a phone, does have like a night mode where the screen automatically removes the blue light. So whether you're wearing blue light glasses or not, if we're taking it away at the source, that's kind of doing the same thing. There's been some subjective studies. So what a subjective study means is that it's like a survey. So they'll ask people like, what do you think about blue light blocking glasses? And those results are mixed, but a lot of them do say that people feel more comfort when they wear blue light blocking glasses. Now, subjective, what blue light blocking glasses do is they take away the blue, and so that makes everything like tinted a little bit yellow. And when things are tinted a little bit yellow, they're almost softer. So instead of having like this bright white screen in your face, it's kind of like a softer yellow. And some people feel like, you know, when they're on screens all day, that's incredibly helpful. But those are subjective. So if you feel like it works for you, great. Like you can do it. It doesn't cost very much. It's not doing any harm. But I wouldn't, recommend it and say every single child who's on a screen, like, definitely needs to have a blue light blocking glasses.
So barring the annual exam, we're coming in every single year, no matter what. What other things can parents do to protect their children's vision?
So we just talked about blue light blocking glasses and how blue light blocking glasses don't necessarily help us with our health. But we do know that sunglasses, particularly anything with UV protection, is good for our health. So not only are we blocking the UV from getting into our eye, we know that UV increases our risk of macular degeneration and cataracts. We also protect the eyelids. So UV eyelid cancer is actually like very common.
How do you do this? Every week you tell me
something that you're like,
just blows my mind. Say that again.
Well, like you wear glasses and they don't just cover your eye, they cover also the skin around your eye. The eyelid skin is like really, really thin. Right? I know everyone knows that, like especially like women who put makeup on, you can almost like move the whole eye underneath when you put on your eye makeup. Yeah. So our eyelids, if they get a lot of UV exposure, you can get like many different types of cancers on your eyelids. And it's not very fun to have. It doesn't look very nice and it's difficult to remove. So by wearing like UV glasses, like we're also protecting our eyes from eyelid problems as well.
That makes it so common sense.
Yeah, UV protection.
It makes so much sense.
I mean, in addition to that, like anytime your child is playing a sport that has a risk for eye things. So for example, like I know the older sport now, maybe squash with like those tiny balls have a lot of eye injuries. Badminton, because the birdie side of the badminton
is
in that
sharp.
Well, it's not necessarily sharp. It's just the perfect size to fit into your eye socket.
Oh, the round part.
Yeah, the round part.
Oh, I was okay.
No, you're thinking about the other side, like the flying
side.
part. Yeah. I mean, that part I guess can cause like some scratches and stuff on the eye.
Yeah.
But I'm thinking more like if you hit the
oh my gosh
the birdie and it actually hits someone directly into the eye. So remembering to wear your protection for that, like, and the same thing with adults. Like if you are a welder, you're going to wear the proper welding eye protection. If you're working construction, you're going to wear the proper like safety goggles or safety glasses. So it's the same thing when we're doing sports. Like you can wear, your goggles when you're playing squash. You're supposed to. Same thing with badminton. If you look like in the Olympics, everyone is wearing the proper eye protection to play.
There you go. Okay, so I identify that I have a vision concern. Should I go see my family doctor, or do most go see their family doctor?
So in a child, if you identify a vision concern, you should come see me.
I agree.
That's the short answer. Optometrists have training in just the eyes. So optometrists do 4 years of school just on eye training. I did 5 years of school because I did an extra year specifically in pediatric eye training. So if your child has an eye problem, I have all the technology, all the equipment, anything I need to identify that problem and treat it properly if it relates to the eyes. And then because I work with the eye surgeons, we have a really, really quick triage system. So if your child comes in and we say, oh, something doesn't seem right, like we have a very, very quick triage to get them in to see the surgeon. It's actually a faster triage than if you went through your family doctor. So family doctors are a really, really great, really, really great point of contact for, everything. They have to know so much about everything. But for example, if you have a toothache, you're not going to go to your family doctor. You're going to go.
Actually, no.
You're going to go to the dentist.
Yeah.
So if you have an eye problem, you're not going to go to your family doctor. You're going to come to see an optometrist. And we just have to make that exact same connection.
That makes sense. So that's doctor versus optometrist. Now, what about pediatric optometrist versus general optometrist?
So I focus a lot on the gold standard pediatric eye exam. So that's all the testing that we need to do in order to rule out all of those common conditions in children. So in my world, every kid deserves access to a comprehensive pediatric eye exam. And in the community here in the interior, like we are available. We are here for you and you can contact us and you can book an appointment. You don't even need a referral. So it's just like with a pediatrician versus a family doctor. So family doctors have a lot of knowledge in everything. Pediatricians have more specific knowledge in pediatrics. So in some areas of the world where, you know, we don't have shortages in all of these professionals, like every kid gets a pediatrician. So if we have access to the resources and we have the ability, then every kid should have a pediatric optometrist and a pediatric eye exam.
Makes perfect sense. So the money and cents behind that, does MSP cover these gold standard optometrist exams?
Yeah. So MSP gives some money toward an eye exam. And they do this like in the entire province for any kid under the age of 19. So it's up to age 18. And what they do is they give $47.08. So we have to think of that $47.
$47.08?
Correct. Once
all
per
at
year.
Once. Okay.
Once per year, $47.08 goes toward your eye exam. So we have to think about that like a gift card. So like the government gives every child a gift card of $47.08, and they take that to us, and it helps to subsidize the cost of their eye exam. So $47.08 per year, because we can only bill that once per year to the government, is about $4 a month. So not a ton of money and resources are going into optometry or going into the specific kids' eye exams. But that doesn't mean that we should sacrifice the quality of care.
And that's a choice we have to make. And I think it's an important choice. So, I mean, yeah, what you can identify in a single exam could have significant positive impacts
100%.
on the children, both in life, in school, in sports.
And if we're not doing it properly, then these things can get missed. And then we, you know, oh, well, maybe it's this and maybe it's this and maybe it's this. And we're flowing now into a different direction where it could have been a simple problem that we could have identified. So again, think of it like dentistry. When you bring your child to the dentist, it's not cheaper for a kid's dental appointment because kids have the same teeth and they still need to be cleaned and they still need to be looked at in the same way. And so like when you bring your child to an optometrist, it's a bonus that the government gives us a little bit of money toward it. But it's not meant to be fully covered. And it's meant to be an insured benefit. That's what they call it. So it's like having a little bit of extended health, like that little gift card that you can use toward your exam. It's not fair, but it is what it is right now. And if you are not able to afford the cost of an eye exam, and if that's, you know, a barrier to you, then call us and let us know. We have a new not-for-profit called We See BC Foundation, which is also going to be supporting children for their eye exams, for their glasses, for any vision therapy or rehab that they need. Because we realize that there's nothing in the community to support these families. So like MSP gives us our gift card, but that's not the end. And you can get access, and these services, like the gold standard pediatric exam, is not just for, you know, wealthy people. It's for every single child, and that's our goal, to make that happen.
And Dr. Capo, you started this foundation?
My mom and I started We See BC Foundation a few months ago. We're still like in the works of getting it off the ground, but it's open and it's running, and we have used it already to support some children in our community.
What an incredible initiative. And I'm thinking this might be a future video series.
Yeah, we'll talk about it probably at the end.
So if a child has pink eye, where do they go?
Come to see me at any time. And
There's
remember,
a pattern here. I should catch on.
We keep emergency appointments available every day. So, and we'll give you a time. So it's not like you go to the walk-in clinic and then you kind of got to wait around. It's like, call the office if your child is having an emergency, and we can say, oh, okay, great, come in at this time and we'll get you in and we can deal with it.
Okay. What is the earliest age, or what's the common age for children to be able to consider contact lenses?
Contacts. So it's really child specific for contact lenses. I'm going to say on average, probably around age 10. But it depends on the maturity of the child. So remember, I gave a shout out in a different video to a 6-year-old who had a really high prescription, who was really motivated and really wanted to get it done, and she did it. Children are not allowed to take the contact lenses home unless they can put them in and take them out at least 3 times by themselves with no help. And that's because, like, if something happens at school, if they get sand in their eye, they have to be able to do things themselves. And so if your child wants contacts, you know, for sports, or in this case, it was for gymnastics, then like it's possible to do. It just takes a little bit of coaching. And I sit with the child myself one-on-one, and we go through it and as many times as they need until they get it. Yeah.
That's amazing. Are there hereditary eye conditions that parents should or could be aware of?
Yeah, definitely.
Okay.
So
what does that look like? Or
from the health standpoint, things like macular degeneration and glaucoma have a hereditary component. So we don't think about it as like, if your granddad had glaucoma, you automatically have glaucoma. We think of it as increasing the risk. So like if your grandpa had glaucoma, you're more likely to have glaucoma. Doesn't mean you will get it. It just means, you know, you are more likely to get it. So things like glaucoma, macular degeneration, eye turns. So like if a parent has an eye turn or a lazy eye, the child is more likely to have that. And then glasses prescriptions. So astigmatism, remember that kind of blur but in one direction, can be inherited. So families with a lot of astigmatism, we see that passed down to the children. And same thing with myopia, with nearsightedness. So if parents are very nearsighted, short-sighted, it's a lot more likely that their children will be short-sighted as well.
What if someone doesn't know their family history? Is
That's
there
okay.
any okay.
Then we just have to go day by day. Like we have a lot of kids, you know, who might be in foster care or might be adopted into a family. And it's like, you don't know. Okay, well, we're just going to have to take it step by step, day by day.
There you go. Okay. True or false? Is there any way I can know what color my baby's eyes are going to be?
Are going to be, yeah, true. You can know. You just have to wait a little. So think about it as like, you know how like when you go out in the sun, we can tan our skin. Yeah. Because melanin forms, and that's how we get a tan. Because when sun reacts with our skin, it kind of makes it darker. So every baby is born with like a really, really deep blue eye color. And that's because the eye hasn't been open to react with any light to produce melanin, same way we do when we get a tan.
There it is.
So when we're born, it's like everyone kind of has this deep bluey gray color. And then as the eyes are open and as light gets inside the eyes, that's how we start to develop our eye color.
Fascinating.
So usually by age 9 months is when we will say, this is the color that the baby's eyes will stay. And then obviously it's genetic based. So like some people don't have the capacity to produce melanin in their eyes, and then you would get blue eyes. And then some people have a lot of melanin production in their eyes, and you would get really dark brown eyes. So usually by age like 9 months is where I would say like, this is probably the color that it's going to stay.
Fascinating. What should parents know about color blindness in children?
Color blindness is a good question. Color blindness, the most common form, is inherited. So it is a genetic condition, and it's passed down through the X chromosome. So it's usually on the mom's side of the family.
Interesting.
And it's way more common to happen in males. So if you have a young son who, and you know, if maternally you have some color blindness history in the family, then it's obviously very important to check your child. Now, color blindness might exclude you from a few jobs. So like there's certain occupations where you need to be able to see colors properly. But usually children who are colorblind, it's not that they can't see color, it's just that they see color differently from everybody else. And realistically, I don't know how you see color either, even though we're both, not colorblind.
Yeah.
So it's all just a perceptual problem. So the most common form of color blindness is red-green colorblind. So you can either think of it as red weak or green weak. So it's not that you can't see green, it's just that you don't see green as well.
Oh, okay.
So for example, someone who might be, red weak, they don't see red as well. They might mix up colors like that have red in them. So like the browns and the purples and the maroons and the red, because they're red weak. So they don't have that red sensing area in their eye. So they won't be able to sense the different types of red in all of those different colors.
So is that the stuff that goes around on Instagram that asks you if you see a number 4 in there? Is that the green red thing?
Yes.
That's
so like you'll see like those little they look like almost bubbles.
Yeah.
And then they'll like a number inside the bubble.
Tricky.
So what they do there is they'll put a number inside that's it's coordinated with the color. So they might remove, for example, like all of the red from that color. And so if you are red weak, you'll see that flat as the background. You won't see the number. But if you have normal color vision, you'll see the number very clearly. So in kids, it's not necessarily, oh no, my kid's colorblind. It's communicating with the school and saying, please don't use purple and red and brown to identify things for this child because they're going to get those all confused. Or when a child starts driving, the color red from the taillights in front of them are not going to be as bright. So that child's just going to have to learn, I'm going to slow down a little bit faster because I might not see the lights in front of me as being as bright.
But Dr. Capo, I find that so significant. Something as, and I want to say trivial, but maybe it's not, I don't know, as trivial as color weakness. I think it can have a really big learning impact on some kids.
Yeah, I think if we don't find it and recognize it, then like a lot of things, you can imagine like a preschool class. It's like, sort all the brown, sort all the red, sort all the... So if we are colorblind, usually, honestly, it's teachers that find it first. And then the parent will come in and say, I think my child's colorblind. And then we check. We check like routinely anyways.
Part of the gold
But even
standard.
so, we can't even get like a definitive test until maybe they're like 5 years old, just because the test involves, picking out some shapes. And sometimes we're not 100% sure if they can't see it or if they're just
don't know the shape.
Or like we give them like a little paintbrush and we'll say like, paint what you see. But like you'll get like really cute kids who just like, and then we're like, I don't really know if you can see it or not.
Okay. What are the most important habits to develop for maintaining good eye health in children?
For maintaining good eye health. So I would say routine exams every year. We're going to spend a lot of time outside and we're going to wear our sunglasses. We're not going to rub our eyes. So we know that rubbing our eyes, like let's say when we have like allergies or if our eyes are itchy, we can actually cause some damage by rubbing. So we're going to say no rubbing the eyes, or if your child rubs their eyes too much, bring them in.
Bring them in to see you.
Because there might be something there that we can treat. And then let's like communicate with our kids and ask them questions. Like if they're struggling in school, like are things sometimes blurry, sometimes clear? Do you ever see 2 of things when there's only supposed to be 1? Do you ever get headaches when you read too much? So like let's ask and let's communicate with kids and ask them those questions, because that is going to maintain our eye health and make sure that we're succeeding from age 6 months and all the way up to school.
Amazing. I love getting to spend time with you, Dr. Capo, and the information you share. You always give me a number of nuggets after every session. So we're probably halfway or 5 videos through the 12 video series. You have an exciting guest coming in the next series.
Yeah, I am super excited. Dr. Taryn Fama-Climont, she's a pediatric neuropsychologist. She's going to be joining us in a few weeks.
In a couple weeks.
And we're going to be discussing some implications with, she does a lot of the ADHD and those types of assessments for children. So we're going to have a really great discussion on, those types of implications as well as vision and how they go together.
Amazing. Can't wait. Thank you very much for coming in, Dr. Capo.
Yeah,
and we'll
thank
see you
you.
in a couple weeks.
Perfect.